Welcome to Clinical Unfiltered, where you guessed it, we are going to unfilter dentistry. Give me your hearts, give me your minds, give me your teeth. I am Dr. Sausha, and we today are going to go on a journey into 3D printing. As I promised, there's a couple topics that I want to do personally, just me. I'm going to run you through some slides. So the visuals help, but I'm not going to make it all about the visuals. I'm going to bring it to you through your ears as well, as best I possibly can. So I'm going to take you on a journey on 3D printing and all the different uses that I have, and I can't do it just in one episode. So I'm going to start off. Today is all about the fundamentals of 3D printing. And I figured the best way I could possibly introduce you to 3D printing is the way it was introduced to me. And so I always like to joke that I think everyone that, when you're in dental school or a pre-dental or residency, you go to all the different conferences that you possibly could go to. I used to, they're free, so free conference, sign me up. I would go, but I would also have a really good time. So I'd party at the parties that they would have. And I would normally wake up around noon. I'd get up, kind of like mosey on into the conference, try to figure out if there's something I actually want to listen to or learn about. And I would look down the list of classes. And the one that always piqued my interest, the one that always got me going was anything digital. And this was circa like 2010-ish, 2009. Yeah, I mean that in that era, digital dentistry was becoming more popular, but it was still very new. So I loved going to those lectures. I would go to those lectures and I would see something that would just be so complex, like the most intricate full arch surgical guides being developed. And I was like, man, that's really cool. But got to remember, again, it's noon. I'm hungover with sunglasses in the back of a dark room, looking up at the slide and being like, holy crap, there's no way my little, like trying to figure out what an MOD or a box prep is that brain is going to be able to go and do something as complex as designing a full arch dental guide. But that's what I would see on there. And I drew back. But I wanted to just dive in a little bit. What I really wanted to get into was just doing a simple surgical guide. I knew if I could do like an easy surgical guide, that would be my gateway drug to doing more and more digital dentistry. Now, back then, I went to Nova Southeastern University for my dental school and my residency. So in a residency, I remember walking through the library, and through the corner of my eye, when I was in the library, I saw like this really fancy machine that had all these like fancy lights coming out of it. And it was new. I mean, I'd gone to the library a million times, never saw this machine. I walk over and I'm like, hey, I mentioned this story to Matt before, and on one of the episodes, I was like, hey, what is this machine for? And they're like, oh, it's a 3D printer. It's one of the desktop 3D printers. We got it brand new, and it was printing a Iron Man prosthetic arm for kids who don't have arms. And it was printing a bunch of them. They had a bunch of them lined up with different colors, and it was the occupational therapists. I'm sorry, the physical therapists, and they had a team that was developing all these prosthetic hands to give to kids who don't have hands. I thought it was the coolest thing ever. I was like, wow, they're just making these. They're like, yeah, they bring us a file and we 3D print them. I was like, whoa, can the dental school use this? And they were like, absolutely, go for it. So that gave me a potential entryway to be able to do 3D printing. And so what the 3D printing that I am talking about is additive 3D printing. You got to understand, we've had 3D printing in dentistry for a very long time. CAD/CAM dentistry, milling machines are 3D. I mean, pouring a model is a form of law, and we've been doing lost wax forever. I mean, the ancient Romans were doing lost wax techniques, and that's essentially a form of 3D printing. But a lot of those forms of 3D printing have limitations in what you're able to create. For example, milling takes a block and you cut back from that block. It's called subtractive 3D printing. You're taking something, subtracting material to create an object. You lose intricacy in your design when you're trying to mill little things inside of a block. You can't get as much complexity of a structure from that. But additive 3D printing is essentially making something from nothing. You basically have in our world a liquid pool of resin that we create into an object that allows you to kind of add things within the object, create complex objects that have intricate canals and formations to them. You can essentially, whatever you can imagine at that point, you can design and create with additive 3D printing, and it's more efficient as far as like waste of material as well. Now, I'll tell you, 3D printing, additive 3D printing is not brand new either. That, like, in the 80s, they created their first, like, what they considered a desktop 3D printer, but it was like the size of a person, and it cost like $300,000. So no one was lining up to kind of put these additive 3D printers in their offices. But come the turn of the to 2000s, late 2000, probably early 2010, that range of time, we start to get what we call these desktop 3D printers. Basically, 3D printers you can put on your freaking desk, just like it says, or put in your office. And these things, they're small enough, so they got a small footprint. They're cheap enough too. So we're talking $1,000 or less instead of $300,000. And that's just $300,000 in 1980s, not today's money. I'm sure it's like $1 million at this stage. But these printers around 2010 are less than $1,000. And these were some of the first printers, I would say MakerBot, the Lulzbot. These were some of the first commercial that people were buying up, and Formlabs existed. But at that era, we were mainly printing in these, what we call these filament printers. So there's essentially two printers that develop around that time. The filament printers, which still exist in dentistry, and they still have a purpose in dentistry too. They have a role to play. They essentially take like a spool of resin, like it's a spool of like a filament of resin. It's like a stick of resin spooled up, almost like a silly string spooled up, and it's plastic. And then it goes through a nozzle that melts it and squirts it out of that nozzle, and it builds it up one layer at a time, almost like making like a frozen yogurt, basically. And so you're building up an object with this melted plastic. Basically, it's gotten different colors, some different materials. But the materials are a little bit more limited with filament printers per se. These were great. I mean, these were great. A lot of things that were printed with them, it didn't have as great of a resolution. You would notice layering in the object. You'd notice the layers that it would print up. And it was stringy, and it could distort pretty easily. It's heat made, so heat again to it can distort it. So it had limitations in the sense that main thing I was using it for was printing like anatomical structures. I did print my very first ever surgical guide with that material, though, because the resin printers didn't exist really at that stage. And so most of my very first surgical cases were actually with these filament printers. Then came these, what we call these SLA or DLP, stereolithography or digital light processing printers. There's variations of them now, but basically, there is a pool of resin. A light shoots at the resin and cures it. Sound like something you know? That's right. Yep, resins, dentistry, right? It's up our alley. Basically, it's a liquid resin. You cure it, it polymerizes, and you've got hard resin. So we use that stuff in dentistry all the time. This one makes a little bit more sense, and it creates better resolution. So the objects that come out of these SLA or these printers that have this liquid pool of resin that cures with light and essentially built it still one layer at a time, the resolution can be really high. I mean, we're talking like microns, enough to where you can actually make final restorations with this type of technology. And so this actually becomes more predominant in dentistry. Formlabs exists. They still exist. They're on their Form 3B29, whatever. There are 10 renditions in. The Sprint Ray is this type. The Prime Print, the Carbon, almost all main dental printers utilize this type of resin. The filament resin, the printers, I mean, those are, you can see, I mean, the contrast of the resolution is so intense that really, if you're getting a filament printer, you're getting it for fun. You're just getting it to print toys. For kids, I mean, if you're a pediatric dentist or you see a lot of pediatric patients, it could be useful. I print that stuff all the time for my kid patients. I don't treat a lot of kids as a periodontist, but I do occasionally. I will ask them at the consult, I'm like, I'll figure out what their favorite thing is, their favorite video game, their favorite character, whatever. Then there's actually a website called thingiverse.com where people have uploaded all their free files that you can download and print. I will go there, pick something out, print it on them for them. I do have a filament printer, so I'll print it in the filament if I can. Otherwise, I'll throw it in my resin printer. But otherwise, the resin printer, if you're going to pick one resin printer, you're going to pick one printer, sorry, you're going to pick the resin printers. And the basic anatomy for all of them is the same. They're kind of set up differently for the most part, but they all have the same anatomy in the sense that there is a tank of resin that sits on top of a base unit where all the machinery is at the base. And this base is very important. It's where the screen will be. It's where there's a glass layer where the light shoots through. You need to be very careful with that glass layer, but it'll shoot light upwards and cure that resin that's sitting in the tank, that's sitting on top of it. And then there's a build platform. And this build platform is normally like a matted metal platform that's on an electric arm or a motorized arm. That arm drops into the liquid resin, and then the light starts to cure. So it'll cure a layer, and it's that accurate. It'll cure one layer and stick it to the plate. Then the arm goes up. So the build platform goes one little inch up, not an inch, but goes a little bit up. Typically micrometers. I mean, we're talking in the micron sections. It'll go up, cure the next layer. Goes up, cure the next layer. Goes up, cures the next layer. So one layer at a time, it builds your object. On the market, as far as resin printers go, I've kind of created like a left to right, cheapest to most expensive range of printers. The frozen printers, the Sonic Minis. I mean, there's so many different renditions of what I'd consider the Amazon printers. You can go on Amazon and buy these things for like $300 to $500 to $600, $700, and they feel like they're that kind of printer. I'll tell you the truth. They're not very robust. If they break down, you might as well just chuck them. But they're cheap enough. So you could theoretically buy a few. If one goes down, no big sweat, you got another one rolling. They do tend to have a little bit more hiccups. You do have to be a little bit more savvy to use them. A lot of people there's a guy named Rick Ferguson who does a lot of 3D printing, and he's very knowledgeable. I mean, he's probably one of the best, I feel like one of the best educators when it comes to 3D printing and digital dentistry. And he does coach a lot on utilizing and being able to use just to give a low entry point for getting into 3D printing. He teaches how to use that, but he's very familiar with a lot of the printers. But he'll show you how to use the Amazon printers and be able to use them effectively. He's even created like his own special parts and pieces that integrate with these cheap printers to make them better. Then there's the middle tier. I feel like most people would benefit from the middle tier, where I call Formlabs and the Sprint Ray fit into that middle tier. And we're talking like, anywhere between $2,000 to $5,000. Once you buy all the components, you might be more in like the $8,000 to $10,000 range. But these printers work really well. They're pretty darn reliable, and they've got good support systems. So if they go down, and if you create a workflow where you depend on this, I freaking depend on these. I need these to be able to function. If they go down, I am SOL. Luckily, I can call support and get good support. I mean, I have a hot swap on mine. So if mine goes down, they send me another one before I even send back mine. I need it that bad, though. So the support cost easily gets covered by how often I use my printers. And so they're really good about helping me out when there's issues. Then there's like the lab printers. That's what I call the expensive range printers. I will tell you, I do not know if there's enough of a benefit except for bigger platforms to print on. Like the build plates are bigger sometimes, and they're maybe a pinch faster. But I'll be honest, the speed and it's not that much faster, and the accuracy isn't that much greater in a dental environment to matter. Unless you're like cranking out like 30 arches of teeth because you're doing suck downs for ortho cases, like you're trying to create a bunch of clear aligners, so you need to print like 30 models where the teeth are just slightly turned each time so that it creates a series of aligners that can move the teeth. You really don't need those stupidly expensive printers. You're not going to benefit as much from them. It's going to be hard to get an ROI on it, basically. So do I have one? Yes. Do I play with one? Yeah, we had one. Correction, we had one. We sold it to then replace it with our mid-tier printers. And I just didn't see enough value in it. But they're still good. They're out there. I just want you to be aware of it. I would say most of you would fall into that middle range because I delegate these tasks and I delegate most tasks. And if you really want to get a good system down, you want to delegate. You're going to have an easier time delegating those middle tier printers versus an Amazon printer. But there's people talented enough. So you know your staff and you work with what you got. There's also what I'd call dental printers now. This is a newer concept. This one's by Dentsply. It's called the Prime Print. Again, if you're not watching, it looks different. It's got a different build inside of it. And the whole purpose of having it built differently is to make it more facilitated for an office staff to use it. It's less messy, basically. It's supposed to be easier as far as like your different technologies communicating with it. You can almost work directly from your scanner to get it sent to the printer. But I'll tell you, most systems now have set it up where you can go directly from scanner to printer, even if it's not what I'd consider a dental printer. Like I know SprintRay, you can do that from a Trio scanner. You can pretty much send it directly to your SprintRay and get it to print right away. That's the whole concept that I believe that Dentsply was trying to do, is create this for a dental office, for dental office purposes, rather than what we've been looking at are 3D printers that have existed for other purposes that we've repurposed for dentistry. So they all look the same because they're all printers for like CAD CAM engineering people. And that's what it used to be for. I mean, it used to be people printing toys, people trying to print out Warhammer chess pieces. It's made for nerds like us. And luckily, dentists are already nerds. So it helps out then that's why we jumped in and dove into the whole 3D printing realm. But like I said, they're thinking about that concept. So it is being geared more and more towards dentistry since we're a big market for them. What exactly do 3D printers print? STL files. They print what we call .stl. .stl. I always ask, people ask me, like, what does that stand for? Do you really give a damn? Do you know what .jpeg stands for? I don't. I do not. If you do, great, good for you. Doesn't matter, really. It stands for stereolithography, I believe, but it's just a basic file format for printing. So JPEG is like your basic, or PNG is your basic image files. STL are your basic 3D object files. So that is what your printer is going to recognize and want to print. So this is what you need to get to give to a printer. And what is it? I mean, these are just some fun files I've made, but what do we typically get as STL files in dentistry? Are your scans, your intraoral scans that are capturing teeth. They're generating or creating a 3D object, an STL file, which then, and it's what basically, if you zoom in at a granular level, it's a bunch of little triangular faces facing each other to create a three-dimensional object. Your 3D printer recognizes it as a bunch of different layers. So almost like a 2D printer, where it kind of prints one little layer at a time, like your 2D printer, like if you were to print out like 20 pages, you'd notice that like one page comes out on top of another, and it stacks up, almost creating a three-dimensional object. That's what a 3D printer is doing, is taking the object, slicing it into a bunch of layers, and curing one layer at a time to build up the object. And that's how 3D printers work. The resolution has to do with the amount of layers. So if you have a bunch of little layers, you're going to have better resolution. If you have big clunky layers, it's going to look more blocky. It's like, back in the day, video games were very pixelated. You didn't have a lot of resolution. Mario looked like 3 like blue and red blocks put together moving on a screen. That's less layers. That's less pixels. Now you get to lots of pixels, like 1080p, 4K, whatever. Now and if you've got more layers in your print, you're gonna have more resolution. Key to it is, can your printer handle it? I'll tell you, most 3D printers print at pretty high resolution. And that's like I said, in the micrometer range. And most of the time they give you like a micrometer meter of like how accurate or what level of resolution you want. The thing is, the resolution is also tied to the speed of the printing. So if you want to print more layers, it's going to take longer. It needs to print, it needs to cure it, raise the actual lever on the machine, moves up, moves back in, prints another layer. If it's doing that a bunch of times, it's going to take longer. If it prints a thicker layer each time, it's going to print it faster. So if you want to print faster, you print with thicker layers, where you're going to have less resolution. If you want to print something with high resolution, it's going to take longer, a bunch of little layers. So you have to keep that in mind. Now I will tell you, back in the day, like the materials to print with, when I first started, it was two. There was two materials. It was like gray and clear. It wasn't even like surgical guide. But I will tell you today, if you go to like Sprint Ray, Form Labs, with their websites, first of all, we're going to be the #1 tab. Then you go under a tab and look at materials. I mean, they've made up materials for things in dentistry that I didn't even know existed in dentistry. So they can really, really come up with every kind of material possible. Now, is everything FDA approved? No. But again, with the push, with the whole going down the route of having printers designated for dentistry, some companies have kind of made a push to get some materials FDA approved. And so that process is coming. So we're not as much in the wild, wild west as we used to be. And so now that's where the introduction, I mean, we've been 3D printing dentures, but we're even getting better at developing FDA approved denture materials to 3D print that have better accuracy and strength. I always like to show people like that Form Labs, like the old school website and what it is now. And now, like I said, you go to any of these 3D printers, typically we have a dental tab ready for us. And it's normally like one of the first or second tabs. And I always like to show people how much Sprint Ray actually grew up from where it used to be, because it used to be a really clunky website. And within 5 years, they got like Usain Bolt as their like ambassador for speed. This is him going bankrupt. So after he went bankrupt, they changed it right away and made it like another sleek, different website, all about printing crowns, because they have the 3D printers for crowns, which we will do an episode on, because I'm going to do a 3D printed crown in my mouth, which I'm really excited for. So how do you actually get, like, what do you need to get to print? All right. So I've told you all the basic components. You need three basic things. You need to get the STL file. And like I said, there's a couple different ways. In dentistry, an intraoral scanner will give you an STL file, which is the tissue and the teeth. Another way is actually the cone beam. So I said you can get it from scanning. You can also get it from a cone beam too. A lot of times cone beams will actually have a button that says upload the cone beam as an STL file. Because normally they come at what we call .dicom files or .dcm files. Again, don't worry about it. It's like a medical-based file. But if you want an STL, something that the printer can read, there's typically most softwares for your cone beam will have a button that's like click, click, and boom, you got your bone. Sometimes you got to clean it up though, because there's a lot of scatter with bone. So you can change kind of the contrast of the bone to reduce some of that scatter. But AI softwares are going to eliminate a lot of that. They're going to be able to segment the bone from the scatter. So you don't have to worry about that. So you can get a cleaner model from their DICOM that you can take to a 3D printer. So now you have to get the file ready for the 3D printer. This is where the softwares is the most important. There's so many different softwares too. And I don't like to get people too confused with all the different softwares, but the most important point about playing with these softwares is you got to have a freaking computer that can handle it. I used to do these seminars with the residents, the perio residents, trying to get them all like digital and into 3D printing. And I had this one like hands-on section where I brought everyone in. I said, everyone open up your computers. I want you to upload this software. I want you to download this software and start playing. Almost all of their computers blew up in front of my face, except for one guy who had like a good computer. Everyone who wants to get into digital dentistry, which you want to get into digital dentistry, welcome to the era of digital dentistry. If you do not have a scanner, if you do not have digital tools, send me the invitation to your retirement party, as I will tell everyone every time I do this talk. You need a good computer to handle this, to let it hum, to not be sitting there waiting for things to load, not waiting for you to turn a file and just watch it stick and get stuck. If that happens, you're going to hate it. You're going to hate the process. You're going to back the hell out of it, and you're going to delay your entry into digital dentistry. There's software. So once you got the good computer, there's softwares for surgery, surgical guide making. #1 software for surgery. Bunch of them out there. Blue Sky Bio, 3Shape. When I do our surgical guide walkthroughs, I'm going to do essentially 3Shape and Blue Sky Bio. They're the main two I use. I really honestly don't even use Blue Sky Bio because we've paid for 3Shape. So I mainly use 3Shape, but I'll show you both. Blue Sky Bio's got a lower entry rate because the software is free. But if you want to make a surgical guide and upload it, you have to pay to play. With 3Shape, it's a little bit different. So the pay structures are a little bit different amongst these different softwares. So you have to just figure out how much you're trying to implement it. Are you someone who's going to make 3 surgical guides a year, or are you going to be someone who makes 100 surgical guides a year? I've got a solid argument to be someone who does do more of them, but that'll come for that episode. Okay, we'll talk more about that. Restorative based 3D printing. Again, we'll have a whole separate episode about this. For restoratives, I mean, these are mainly lab owned and operated. We're talking 3Shape has their version of it. In Lab from Dentsply, Exocad are some popular ones. There's some AI ones. There's one I came across called DentBird, which is like this AI generated design software. It's free, so you can design for free, and it's a web-based app. But to upload the file is a nominal fee. So you can upload the crown design as an STL file and then print. So my goal here is to actually have someone prep on me, scan me, then we're going to send it to DentBird to design it, and then I'm going to 3D print it for a total, I think, of it was like $8 or something like that. So we're talking like a $12 crown, and it's supposed to be definitive. So we'll see, and I'll rock it out for as long as I can. Hopefully I do an episode in 20 years to say, hey, it worked. So there's a lot of softwares where you can design things and get an STL file and take it to the printer to print. There's ortho file. I don't really mess with the ortho 3D printing, but I'll get someone in here who does. I do know an orthodontist who does use and print a lot of their own models using different softwares to then create their own clear aligners. Now, granted, though, we working with Dr. Vela, we do a lot. The Invisalign is a different process. That's not exactly what I mean here. I'm talking about creating something in an ortho software that you could then 3D print yourself. And it can even be as simple as printing a model for the sake of creating a retainer. Because I know sometimes a lot of people like lose their retainer and they're freaked out because they're going to pay exorbitant fees just for a retainer. If you're making them in-house, it really doesn't cost you that much to make it. So you can prepare that as a service to a patient to hook them in on some other treatment. One software I always recommend, and these were actually one of the early companies that got into CAD designing, was Autodesk. And they have a free software called Mesh Mixer. You can go right now, if you're not at the gym or in the car, you can go right, unless you're in a Tesla, then you could probably pull out your laptop and do this. You can go right now and download Mesh Mixer on your computer, and you can play with any 3D file. Go to thingiverse.com, upload a file of a hand with a middle finger up. I don't care what. Bring that into Mesh Mixer and play with it, just to get a feel of messing with 3D objects. This is essentially, this software is like Paint was for images. Mesh Mixer is for 3D files. Easy software to use, relatively speaking. Tons of YouTube videos on how to use it so you can learn on your own and be able to manipulate objects 3-dimensionally. I used to make bleaching trays with this. I would essentially just take a model, I'd take my STL that I got from my intraoral scan, plop it in here, and make little extrusions on the teeth. I'd paint a little layer of material on the teeth and then 3D print that model. So I wouldn't have to actually do it in real life. I wasn't wasting any material in real life to bulk in the facials to create bleaching trays. So, and it's great to manipulate any file, really. But one great use, like I said, was for bleaching trays. Then and this is another important software, is every printer has their own software. So I just went through all these auxiliary softwares that you can use in dentistry to get STL files: surgical, restorative, orthodontics, Mesh Mixer. Once you have those files, like you have a finalized STL file, whether it be surgical guide, a denture, whatever the heck you're printing, you have to then drop it into a printer software for the printer to be able to finally say, this is what you want me to print. So this is your communication tool to the printer. This is how you talk to the printer, is through their software. Formlabs, I think, has Formware. SprintRay has Rayware. They all have their own proprietary software. Some are better than others, I will tell you that. And so basically what you do for these softwares is you literally drag and drop the file. You literally drag and drop the file in there. And then you'll also create these things called supports on your print. And you typically want to put the supports in a place that doesn't mess with your printed object too much. For example, surgical guides, I always put it on the side that doesn't go on the teeth so that it can go on the teeth clearly. Again, we'll go over that in the surgical guide episode. But you basically need these supports so that when it's printing on the platform, because what it's doing is The software is simulating the build platform. It's saying, hey, here's the build platform. What do you want me to make on it? You drop the object on there, but there's a lot of like weird spots where if it did just print that, it would fall off the build platform and fall into the pool of resin. So these supports, which are auto-generated, you just press generate. There's normally a button that looks like an object with sticks on it. And you press that button and it'll generate these sticks that form on your object. These sticks are typically, you can break them off with your fingers, and their whole purpose is to essentially keep the object from falling into, and printing accurately, and keep it from falling into your tank of resin. So it keeps it from falling and keeps it more accurate because it's not letting any weak points in the resin develop. This part can get really technical. I don't want to get into that part, but there's basically a button you press, and that's all you need to do to be able to generate these supports or sticks for your 3D printed object. And then there's a button that hits print, and then you're done. I will tell you, sometimes people are like, this can get super complicated. You just threw like 30 different softwares at me. The key is find that one thing you want to print, whether it's a crown, whether it's a denture, whether it's a surgical guide. For me, it was a simple surgical guide. That's all I wanted to print, and I focused on how could I get to that point. So my whole trajectory into 3D printing and digital dentistry, why I'm here on this podcast talking to you and partnered up with Dr. Velo, and all the things that have happened in my career have come from that drive to make a stupid little single surgical guide. And then you just have to get out there and just play with the damn stuff. You have to fail. You have to bump into things. Like I always tell this about any learning experience. You have to want it. You have to fail at it and figure out why you failed and then get better. It's as simple as that. So great. You've put now you're actually going to the printer and it's printing. Normally, it depends on what you're printing. It's going to take between 15 minutes to 2 hours to print, depending on the height of the object. The taller it is in your software, the more layers it's going to have to go through, the longer it's going to take. So if it's really shallow, which like a model is in a surgical guide, sometimes can be really short. And so even though it's long in like horizontal dimension, as long as you don't have it vertically tall in the software, it's not going to take that many layers to print it. It might be wide, but it doesn't take that many layers to go vertically. Vertical layers is what makes it longer to print. Once it prints, it normally comes out of the machine on the build platform, and it's normally gooey with excess resin because it's been sitting in a pool of liquid resin. You have to wash off that extra resin, normally in like a really high concentrated alcohol. We're talking like 99.9% isopropyl alcohol. And most of these machines have a designated bath for their 3D printed guides, an alcohol bath. I used to just use like a tub of alcohol, like a plastic Tupperware container, and dip it in there, and then have one of those like magnetic spinning spools that we used to use for beakers that would spin the alcohol to clean it. And I would just dunk it a bunch of times. That was really inefficient and messy. These machines that they sell are relatively inexpensive, and they do a great job of cleaning off the extra resin that's on your 3D printed object. So it comes out nice and clean. Once it's clean, though, it's not fully solidified yet. These need to be cured a little bit more. Some people like to remove the sticks before they cure them. I typically do. I typically remove these little extra sticks. And like I said, most of the time it's finger pressure. Sometimes I do have to clip a couple extra sticks to not break the object, the actual thing I meant to print. And then I take it to a curing unit. Again, I used to use a nail polish curing unit. When I bought on Amazon, I used to be really slim in how I used to operate with these things in residency because I didn't have a lot of money. So I was just trying to figure out ways to use it. And that's how I actually still practice a couple years out of residency. But now the ROI made sense that I bought the damn things to do this thing right and efficient and delegate. Once I wanted to delegate it, I needed these actual machines to make it easier for my staff to use it. And then the curing units are designed to cure these things to the correct amount rather than a nail polish curing unit. So they'll cure it and harden it to its desired hardness. And of course, it just depends on the material. Then, also depending on the material, you polish and clean it up as much as you want to make it look fancy. I will tell you, labs that use printers do a lot of this afterwards so that when it gets into your hand, it looks awesome. You can tell by a lecturer who's sending out for it versus who's doing it themselves. Because when I see a lecturer show the most polished guide in the world, they're sending out to a lab to do it. When I see a guide that has a bunch of sticks still left on it, that's a doctor who's printing the guides himself. Guess what? They work exactly the same, especially sometimes even better in the hands of someone doing it themselves. Yes, it can create a mess. This is where this part of the talk, I'm going to tell you where it gets like real. Like there are some issues with 3D printing too. I love this stuff. Some issues. It does create a mess. All those sticks and stuff like that pop off there, you have to be able to throw it away. Sometimes when you clip those sticks, make sure you're wearing glasses because they can fly at your eyes. And tell me how I know. Plus, it takes up some footprint. Now, granted, compared to most lab equipment, it's not the most amount of footprint. Sometimes people like to display this because it's a cool, neat little piece of technology to show off. The only thing is just be aware that it does create a little bit of resin mess when things spill or don't work properly. It can get a little messy. And again, prints can fail. Then you have to figure out, is it what's causing that? Again, the more you play with it, the better you can handle it. But is it the resin? Was your resin dirty? Was your resin tank dirty? Did you already have a failed piece of plastic in there when you print it? Is there something wrong with the printer? Is it not heating up right? All these things, though, it does help when you talk to support. Sometimes it will guide you through the troubleshooting process. Some of them, depending, again, the type of printer. And one of the things I noticed on my older form labs, they used to break all the time. I'd have issues with the printers actually physically breaking. And of course, like I said, the mess. I always put like blue parchment paper, like surgical drape around the areas because we will spill resin occasionally. And that resin, it's not the best stuff to get stuck on stuff. It's like, you ever like mess with a jar of honey, or even just, you don't even have to touch a jar of honey. You open up the cabinet that has the jar of honey and you look at it, then you close the door, and then somehow, some freaking magical way, there's honey on your freaking fingertips. I don't know how it happens. I feel like David Blaine is sitting there just rubbing it on your little fingertips when you're not looking, but it happens. And the same thing happens with this damn resin. So get ready for a little bit of mess. But it's as simple as putting paper around. You can wipe things with alcohol, and you got to be very careful carrying around the trays. You're changing tray material. Like I said, if you want to print a denture, you have a different tray with different resin sitting in it. If you want to print a surgical guide, you have a different tray with surgical guide resin in it. For example, my Onyx, I have a tray with Onyx resin in it. When I go to put it on, I have to be completely flat. If I turn a little bit, it'll spill out and also mess with the tray a little bit. If it gets underneath the tray, it can ruin the trays. And of course, depending on the company that you work with, sometimes they require you to open these damn things up and actually become MacGyver and fix them. I tend to like I said, we've bought our Sprint Ray through Patterson, and they actually will come and troubleshoot it before they have to actually communicate with Sprint Ray. Say, hey, we need a new printer hot swapped while we take care of this printer. Thank you guys so much. And we're going to, like I said, we're going to go continue on this 3D digital printing realm. Next episode, we'll probably dive in to surgical guides. And then we'll talk a little bit more about some restorative techniques that I specifically use it for. And I'll bring on some guests to see how they use the 3D printers as well. Thank you guys so much for getting unfiltered.